My name is Vikram Patel. I'm a professor of international mental health and a Wellcome Trust Senior Research Fellow. I work for the London School of Hygiene and Tropical Medicine, but I'm mostly based in India, where I work with a community-based NGO or non-profit organization called Sangat, which is located in Goa, which is a state on the west coast of India. I came to Duke in part because I've had an association with Michael Merson, the director here, for a few years because of shared interests, and he had expressed an interest in strengthening mental health as part of the Global Health Institute in Duke. It was really a kind of a trip for me to understand a little bit more about the kinds of work, areas of work that people in Duke are doing in global mental health, and for me to share my own experiences with people here about possible strategies for their work in the future. A key element of global health is equity, which is to say reducing health disparities. And I would argue that mental health lies at the heart of global health for that one reason above all else, that being that people with mental illness systematically experience worse qualities of life and shorter lives than people without mental illness in every society across social classes. The kinds of investments you would want to make is investing in research that allows us to answer questions on how do you deliver the existing proven treatments in places where there are very few specialists, and typically that will involve using non-specialists to deliver frontline mental health care. Some of the most exciting work that's happening in developing countries today is using lay people, for example, who are trained and supervised to deliver mental health treatments, psychosocial treatments, and so on. The second kind of inequity, which is to do with the lack of research on understanding mental illness and mapping new treatments, which I think is stunting the very science of psychiatry, would involve really beginning to examine the nature of mental illness. For example, clinical presentations describing phenotypes, and doing etiology-related work, genomic work, for example, in diverse populations around the world, not just simply researching, as I said, 5% of the world's population, but throwing the net out to the other 95% of the world's population in the hope that by doing so, one will discover the nature of some of these very complex conditions. I mean, one has to admit, we really are still a long way from really understanding the fundamental nature of many of these afflictions. Most global health programs still do not have mental illness as one of their health condition priorities. So that really begs the question, why? There's no shortage of evidence on cost-effective treatments, on the impacts of those treatments, on improving people's lives. Why is it that people are reluctant to support the implementation of that knowledge? My own personal speculation is that stigma is clearly one of those reasons, but it is not the only reason. I think it's maybe about how you can feel compassion for certain problems more than others, and whether we've been able to effectively communicate to the larger public, and particularly to global health decision makers, about the personal impacts of mental illness. Maybe move away from these numbers and these figures and actually start talking about stories of people's lives. And I certainly am increasingly moving towards working with civil society groups to try and find ways of communicating the personal to the global audience. It's that kind of imagery that they're just like you and me. And I'm hoping that that kind of strategy might be more powerful than science alone. There is such an amazing growth and demand to be involved in global issues and global health in particular. And global mental health is going to benefit from that, because these students have grown up in societies where they have witnessed the burden of mental illness in their own worlds. And there is no reason for them to believe that these impacts would be any different in the developing world. And they are going to ask questions. Why is it that when we go to the developing world, somehow mental illness doesn't appear on anyone's list, when in fact it's no different from the rich world? I think this is potentially the force that will finally put mental health further up the agenda. So we need people in universities like Duke to be actively involved. One of the very important efforts that I am involved with is really to take this message to as many of these groups as I can. My visit to Duke, in part for me, is part of my own mission. It's about sharing these ideas with as many different groups, because I do think that in doing that I play out my own objectives of getting more and more people involved in global mental health.